This week on the Capitol Report, Budget Secretary Ben Barnes takes on detailed questions from legislators about the governor's proposed budget. The presidents of UConn and the college and university systems speak frankly about the impact of state funding cuts. And conflicting testimony on a bill to require motorcyclists to wear helmets in Connecticut. Now, the Week in Review on the Capitol Report. With Governor Malloy's proposed two-year budget officially on the table, attention now turns to Step 2 in the state budget process, the legislature's review and revision of that proposal. The main points of the plan: it fills a projected deficit of $3.6 billion over the next two fiscal years, with union concessions yet to be realized, state agency spending cuts, new revenue, a reconfigured formula for municipal aid, and a shift of 1/3 of teacher retirement costs to towns and cities. The budget writing committees, Appropriations and Finance, Revenue and Bonding, each held meetings with Budget Secretary Ben Barnes to get some initial questions answered. Last Friday, members of the Appropriations Committee concentrated on several areas, including the $700 million in state employee concessions assumed in next year's budget and the backup plan of 4,200 layoffs if an agreement is not reached.
Have you, in fact, accounted for laying off 4,200 employees as the alternative plan that the governor spoke about in anywhere of your planning documents?
The budget reflects our preferred option that we accomplish these savings through agreement related to wages, benefits, and pensions. And we are optimistic that we will be able to achieve that, and that is the path that our budget reflects. Were we to embark on 4,200 layoffs this spring, were we to do that, that would require significant statutory change, because there are dozens and dozens of activities that we would no longer be able to do, which are currently mandated by state statutes. So we have not presented, for instance, a legislative program that eliminates state services in order to accomplish 4,200 layoffs either. We're all going to be here together in the beautiful city of Hartford for the next 4 or 5 or 8 or 9 months, however long it takes. And during that time period, if we end up needing to go down a different, less mutually advantageous path, in my view, of achieving savings through layoffs or other means, service reductions, we will at that point begin to develop very specific plans for how that would be carried out, what the cost of that would be, and what the legal requirements that we would need your participation on in order to make that happen.
Also questioned, the governor's plan to change the education funding formula to give more aid to large cities.
ECS. Mm-hmm. Most of us that are going to be zeroed out by the proposal, we go back to our taxpayers and say, look, you're paying 98% of educating the kids in our town, and now we're telling you that's not enough. You're going to have to do 100%. And we're going to have that conversation if this moves forward. When I looked at last year's budget, one of my towns was getting about $200 a student. Hartford was getting almost $10,000 a student. And we weren't questioning whether or not they needed it. But for me to go back and say that $10,000 wasn't enough, they needed more. Can I guarantee my taxpayers that those extra dollars that they're going to be paying now is going to go to those kids in our urban areas?
Well, Hartford's a tough example because there's a lot going on in Hartford, but they have a mill rate of 77. Waterbury has a mill rate of 55. New Haven has a mill rate of 44. Bridgeport, I think, is 52, 53. These places have very, very high tax rates on their populations. Now, in Hartford, they're spending a lot on their schools. In Bridgeport and New Britain, they're spending less on their schools. I think that if we give more money to these places, should Hartford increase the amount of money they spend on their schools? I don't know. I actually would encourage them to find ways to spend the money they're spending right now more effectively. We should all be trying to do that in our local school systems. But perhaps in some of the big cities, that's especially important. But I would argue that if we give more money to some of these towns that have developed these extraordinarily high tax rates in order to support their public school systems, it's only reasonable that they should be allowed to use some of that money to keep their taxes low.
I can't help but noticing, being from Milford, and seeing the incredibly precipitous drop in ECS dollars, compared to no other community, it looks like it's an $11 million cut and a wiping out of ECS, a $10.8 million drop, which really decimates our town and our town education funding. And as I look comparatively up and down the line, it doesn't look like there's anything comparable in that cut. And I'm wondering if you could just share with me, how in that change in the formula you come out with that kind of incredibly devastating cut.
I'll start by saying the town of Groton suffers a similar fate, and to a lesser degree, the town of West Hartford. The town of Milford, I live near there and have some familiarity with the community, has a couple things that I think drive this. Their student enrollment's gone down quite a bit. They're 10% down from where they were 5 years ago. They have a really tremendous grant list. They have a long stretch of Route 1. They have a long stretch of waterfront. Towns on the water have fared extraordinarily well over a long period of time, over the last 20 years, since the ECS grant has been, begun its manipulations. Towns with waterfront have seen their grant lists grow better than the rest of the state. It also has relatively low levels of student poverty. When you calculate the grant using the numbers that we put in place, which we thought reflected an appropriate set of sort of values, that yes, we should aggressively provide more funding to communities that have lots of poor students, and we should aggressively seek to offset low ability to pay based on property taxes. We built those into the formula, and that's how the numbers came out. I hope that we can not use the challenge in a place like Milford or Groton, West Hartford, as a reason not to do the right thing and have a real functioning formula and have a formula that addresses ability to pay and student need. I think we may need to find ways to soften the blow, provide a number of years to adjust, maybe to really look at the factors that we've put in, if maybe there are other factors we haven't considered.
Secretary Barnes went before the Finance Committee on Tuesday, where he focused on the revenue side of the governor's proposed budget. The plan includes the elimination of the $200 property tax credit, an optional hospital property tax, an increase in the cigarette tax to $4.35 a pack, in line with New York State, an increase in the bottle deposit fee from 5 cents to 10 cents, and an increase in pistol permit fees, going from $140 to $370 for the initial permit, with the 5-year renewals going from $70 to $300. This was one area questioned at Tuesday's meeting.
That's a huge increase. That's a 400 and something % increase in a fee. How do we justify that to many people who just simply can't afford that?
It is in line with our neighboring jurisdiction, although higher than other neighboring jurisdictions. We think that it's a reasonable amount given the other costs of gun ownership. We think that it's not unreasonable, and we think that it's more fairly reflects the costs of general enforcement of our gun laws.
Just to follow up with Senator France's question on the gun permits, I know you'd made a reference that there's another state near us that have a similar level. Do you know what state that is? Because I couldn't.
New York City. It's actually a city rate.
Okay.
New York City charges $350 for a 3-year permit.
Okay, thank you. Because I've noticed, the other states are actually significantly less than we are at our current rate for the most part.
Yes.
And one of my obvious concerns is that we are dealing with a constitutional right and someone's ability to exercise that right. Have we looked into that, of how high a fee can go before we're infringing on somebody's constitutional rights?
Well, I haven't done a legal analysis of that, but being lower than New York City's rate would suggest that since their rate has not been successfully challenged on federal constitutional grounds, that our rate, which is a 5-year rate at a lower dollar threshold compared to their a higher dollar 3-year rate, I think we presumably would pass that standard.
The increase in the bottle deposit, you're recommending going from 5 cents to 10 cents on a number of bottles. Just wondering what that rationale was and where that came from.
If you look at the states that have done it, they've had, well, the state that has a 10%, 10 cent bottle deposit, they have been successful at eliminating litter and all the other sort of ancillary benefits of a bottle bill. We think that it will encourage more rigorous recycling and ultimately will produce more receipts revenue for the general fund.
As far as I'm aware, the redemption rate jumps up quite a bit in the states that have the 10-cent deposit, as much as 90% in some states. So that, I don't know if you're aware, but we may increase the redemption and recycling rate tremendously, but you may shrink the SGs that now go to the state. So I don't know if you've done that calculation.
I will confess that I have relied on the wisdom of smarter people than I am to calculate that, and I have not inquired as to what level they I'm sure, attributed a growth in redemptions. Whether or not it's sufficient, I'm certainly open to having that discussion.
Yeah, it's just something to keep an eye on, because if we go, we're a little over 50% now, redemption rate. That's dropped from a few years back when it was closer to 80%. But if we're at 50% and we go to 90% redemption, obviously the SGs is going to rapidly change. So
Yes,
it's just worth doing the math on that again.
I agree.
The new taxes on hospitals. One of the concerns that we're hearing from them is that they have done this before with promises of recouping from federal funds to make up the huge loss that they would have, and that it hasn't always worked out as well as predicted or forecast. Their concern and question is that will federal funds, net new dollars, be coming to Connecticut in the next few years should this particular proposal go through? Can they be assured that in the new climate and new arrangements in Washington, D.C., will those funds actually continue to be there to come back to compensate our hospitals for such a massive increase in costs that they have to bear?
I have said to the hospital industry in private and in public that we are willing to entertain whatever protections in state statute we can put in place to protect their supplemental payments in the future. However, I don't think any of us, and certainly not me, I'm in no position to make any assurances about the direction of federal Medicaid policy, and I am also very apprehensive about that future. So I understand their concern in that regard, and that's something that we will have to work around given the uncertainty in which we're all operating.
Well, then can I infer by your answer this that possibly then the state might have to cover any of that shortfall going forward should the federal government not come through?
That would be a decision the state would have to make at that time.
The biggest of your proposed spending reductions, which is the $700 million in labor concessions.
Yes.
Now, you've indicated publicly that if that $700 million is not met, that could mean at least 4,200 state employee layoffs. Is that correct?
Yes, I have said that.
I'm just wondering if,
Oh, yes.
If potential job losses have been factored into your revenue projections in terms of income tax revenues and sales tax revenues.
No, we built our budget around with the starting assumption. I mean, it's the first day of a new budget session, so we were optimistic, and we always are. And we proposed that we intended to obtain the $700 million through changes to our underlying collective bargaining agreements that we were seeking on a voluntary basis with our employees, and we are continuing to work toward that and assume that we will achieve that. Now, we are realistic enough to know that we should begin to develop contingency plans in the event that that does not occur, but that still is our favored plan, and I believe that it is the plan favored by many of the people involved in those discussions.
$700 million worth of concessions, raising the PLAs. you know, it seems to me like there's a bit of a shot at working people in this budget, and I have some grave concerns with that. I will say this, you folks did your job, you proposed a budget. It's our turn now to work on what works best for us as legislators and make our decisions, and hopefully down the road there'll be something that we all can work on together and get past. But those are two really big ticket items that I think, you know, we've been very generous with our support of corporate dollars that we've given to keep employers here, but yet we look at people that provide important service to the people of the state of Connecticut and say, not you.
Looking ahead, it's expected that the Appropriations Committee will come up with spending revisions to the governor's budget and the Finance Committee with revenue revisions in late April. A final budget bill will be negotiated after that, with the hope it can be passed by the end of the 2017 session on June 7th. The new budget year begins on July 1st.
Good morning.
As part of the legislative budget process, the Appropriations Committee breaks down into subcommittees to hold hearings on specific areas of the governor's proposal. On Wednesday, the focus was on the higher education portion of the budget, with UConn President Susan Herbst testifying first on the governor's proposed 4.5% state funding cut.
This represents a reduction of about 7.2% from our fiscal 2017 appropriation, or so it's about $28 million. This would be a substantial reduction. It doesn't come as a surprise given the state's financial challenges, and we know that the proposed cut to UConn could have been much more severe. So we're very grateful for every penny of appropriations that the state is able to provide, especially during these extraordinarily difficult years. A reduction in the amount proposed will shrink our faculty, which means bigger classes and fewer of them. So students may not get the courses they need when they need them. It tends to slow their progress to a degree, and it adds to the course of their education because then they might have to stay another semester or a year in school than they'd like to. So with these kind of cuts, we would look at closing multiple academic programs and eliminating some academic majors. We won't have adequate financial aid for all of our students, but we will do the best that we can to help our students. So these actions all taken together, they start to lead to an even more accelerated decline. So we'll drop quickly in the U.S. News and World Report rankings and all others.
State support for the university as percent of our total budget has declined in recent years, and we have raised tuition and mandatory fees. That said, we are, based on the governor's budget, we are currently in a place where we think we can live within our current tuition plan. That is, we have our Board of Trustees and our administration have worked together to put a 4-year tuition plan in place that does have modest increases over the next several years, but that the governor's budget can be supported by the university without an increase, further increase in tuition.
I did notice the amount of construction, and it's beautiful, but as the sister of a UConn grad in the 80s, you know, we were talking about the vast differences in the campus. So I'd like to know what your philosophy is going forward with this limited budget availability, with the fiscal crisis crunch that's happening now and unfortunately for the foreseeable future. What is the slowdown plan? Because, you know, I remember when we were building a house and I wanted a larger closet, and I was talking to one of my earliest mentors who was very fiscally conservative, and he said to me, Melissa, the bigger the closet, the more crap you're going to put in it. And I thought, you know what, you're right about that. So my concern is the bigger the footprint, the more stuff needs to go into it. So are you considering slowing down that footprint, and what does that plan look like?
Yeah, I mean, no university wants to slow down because for us, the stuff that we put in the closet are scientists. And those are people who, you know, create inventions and are helping to be economic engines for the state and students. So, you know, for us, the stuff in the buildings is really meaningful. That said, we're about done with the big building projects. I mean, we would love to build more. We would love to be an even more extensive campus that can do more for the state's economy, but it's about done. We have a big science complex that we must build. in order to fulfill the state's demands for next gen and creating more engineers and inventions. So we have to do that, but we've canceled most of the other projects.
The freshman class is smaller this year, as I understand it, than last year. And so can you help me figure out how it is that we're meeting enrollment targets for next gen if in fact we're enrolling fewer students?
Yeah, meeting them up until now. It's done. Now we will no longer meet them. So, yeah, that was we're under the wire there, and it's it's to boost number of students in the STEM field, so particular kinds of majors. But yeah, that's it. We're just not going to be able to fulfill the dream of that legislation. It's just not going to happen with this kind of state budget.
Could you just talk a little bit about the percentage of the state budget that really goes toward your budget, the 28%, I believe it is. How does that compare to other universities of your caliber?
Yeah, it runs the gamut. There are some states that are down to 2-3%. I mean, I think Michigan's probably down there right now, and others that are down in that area. The trade-off that they have made with their state is that they have freedom to charge as much tuition as they'd like. They have that more in their control. So that's the kind of, and also they made trade-offs on regulation. So, basically they said we take fewer appropriations from the state if you would deregulate us in certain ways so that we could be more entrepreneurial, get better deals, do that sort of thing on procurement, for example.
This issue with regulation you talk about, is that something that you're having conversations about and thinking about if that frees up potential opportunities?
Yes, we have had a conversation with some of your colleagues about this, most recently Senator Fasano, and so I know that he's thinking about it, and so are the governor's people and some others. But yeah, we would like to be able to be as entrepreneurial as possible, to work with private industry in a nimble fashion so that we can save money for the taxpayers.
Next to testify, Marco Jakian, who now oversees the state universities and community colleges under the Board of Regents for Higher Education, a system that has been struggling from continued state cutbacks and decreasing enrollments.
So if you add these shortfalls to the proposed cut, it leads to a projected deficit of $33.4 million in 18 and $57.5 million in fiscal 19. Now, if that wasn't bad enough, if the proposed $700 million in state employee savings the governor has assumed in his budget are not realized, the additional cut to our system would be $31.8 million. So this would represent a total cut of nearly $81 million, or a 14% cut in 1 year. Balancing our budgets solely on tuition increases is something I will not do. Though it must be part of any conversation, we will not balance the bulk of this cut on the backs of our students. If we were to address this entire cut through tuition, it would increase tuition by at least 8% across the system. And in some cases, for example, at our community colleges, would increase it by close to 11%. So since I've been president of the system for the past 15 months, it has become very clear to me and to the Board of Regents that the structure of our system has not been and will not continue to be sustainable in the long term. This is something that unfortunately was never dealt with since the inception of the merger. That is why the board has asked me for a plan to deal with the structural deficit and the long-term sustainability of our operations. Now is the time we need to make tough decisions about how we are going to structure our system to ensure the continued access, affordability, and student success that our institutions deliver. So let me say clearly here this afternoon, all possible options are on the table.
If we don't see the $700 million CBAC agreement savings, how many teachers do you think that will impact in your system?
Well, there's a couple of points,
Okay.
to raise. I know that the governor's budget had an associated workforce reduction number
Right.
in there, and I'm assuming they just took an average state employee salary as they tried to figure out what that would mean. As you know, UConn and the Board of Regents is considered an other employer for purposes of workforce reduction. So we have very different, and we also have very different contracts as well. So many of a couple of our contracts, the ones that cover the professors and the ones that cover our what's known as administrative faculty, have clauses in them which require the board to declare financial exigency before there can be any reduction in workforce. If you get to an $83 million cut, there aren't many places to go other than declaring financial exigency. I'll just be very honest. I mean, $83 million cannot be sustained even with a newly
Could you repeat that? Declaring what? Because I'm hearing-
financial exigency.
Okay.
And now there's a legal threshold that you have to meet, to get there. As I understand it, and I'm not an expert in this area, but all your reserves have to be spent down. Some of your assets have to be sold. It's the equivalent, to me, of declaring bankruptcy and starting all over again. That is not something I'm excited about considering, but $83 million leaves us little choice. Now, Representative, the other thing I'll say is, as you look around at other systems around the country that have faced similar challenges, you've seen campus closures, you've seen consolidations, you've seen universities merging together. Pennsylvania is now going through an exercise similar to ours, where they are, looking at closing institutions because the severity of their budget cuts require them to look at this. And so in an ideal world, nobody would have to consider those kinds of things. You get to a cut of between, $33 and $83 million, and you have to start having some of those tough conversations.
Later on Wednesday, members of the public got a chance to testify on the proposed higher education cuts. Panels of students, faculty, and business leaders spoke against the cuts for several hours.
Everybody you see standing behind me is depending on you to reduce these cuts, to invest in them, in their future, to invest in the future of this state by maintaining state appropriations to UConn. These cuts pose a threat to necessary programs and services that have allowed these students to flourish and succeed.
As our business grows, we need more engineers. We need engineers specifically trained in composites, and that is at risk. Programs like ours with the School of Engineering, which are in its early stages, are most at risk in the current budget environment. To deliver on the promising future that we have, we are all in this together. UConn's success is GKN's success, is Connecticut's success.
No longer can a student simply go to class, take exams, graduate, and expect to be hired. What UConn needs to continue to do is improve in all aspects of education, both in the lecture hall and beyond, to take our graduates to that extra level and prepare them for this new employment field. With the threat of serious budget cuts, pressure upon the administration to do this is nearly impossible without raising students' costs of attendance. But this is a vicious cycle that inevitably leads to more crushing debt. What I would like to see in our university in the next decade is to keep the momentum that has built up just in the past 3 years that I've been on campus. I want every budding scientist to reap the benefit of cutting-edge facilities and engaged faculty that will train a new wave of scientists to innovate across disciplines and to be inspired by their peers to reach higher.
I believe that the 4.4% budget cut to the CSCU system is detrimental to not only the students who cannot afford a tuition increase, but also to the longevity of our state. As of 2013, 65% of students who attended public higher education institutions graduated with some degree of debt, the average being around $25,000. Many students cannot afford to incur this debt and struggle to pay for their college education. I know that as we raise the cost of attending our public institutions, we will be pricing out a demographic of disadvantaged students.
We need resources. UConn needs resources to keep this learning environment at each of its campuses vibrant and dynamic. We need resources, facilities, like the new Next Gen dorm, like the new technology incubator building. We need research, funds for research, so that scientists like me and others can continue to bring new knowledge into the world. And finally, UConn needs resources to recruit and retain their talented faculty and students. Faculty to teach the courses and create the programs that guide our students to become the most impactful and engaging change makers in Connecticut and beyond.
Industry standards for manufacturing are set at Nantucket, and to reduce the budget along with the well-educated and experienced staff would be a disservice not only to students but to employers all across New England as well.
I decided to attend Gateway because it was less than a mile away from my house, where I reside in the Hills section of New Haven, and the cost of tuition isn't as much as attending a four-year university. Upon my admission, I learned that I could be eligible for financial aid and I wouldn't have to pay as much out-of-pocket expenses. This was music to my ears because I was out of work with no income and I have 3 children to support. I'm here to tell you that the system works. I really hope that the budget cuts won't affect our future students or take away the same resources that I was given. Thank you.
I want to thank you all for your testimony. This is going to be hard. Excuse me. Coming here and listening to you today, thank you, is amazing, because you guys have shown so much perseverance, determination, despite what life has given you. You have shown everything that we expect of all our students. Thank you for coming and testifying. And, you know, I have to tell you, I got so moved in the very beginning. I applauded. And I have to apologize to my members here today because we don't allow applauding. Because it's not appropriate. We have to listen. But today, I'm proud that I applauded because you guys make me extremely proud. Thank you.
The Appropriations Committee has budget hearings such as this one scheduled through next Friday.
Good morning.
State legislators are beginning to see the fallout from their rejection of the state's revised WANF settlement agreement, which was designed to get the Department of Children and Families out from federal court oversight in place for nearly 3 decades. The House and Senate voted down the deal in large part because it would have locked in the DCF budget for an undetermined amount of time. In response, the budget proposed by Governor Malloy increases the DCF budget to account for the WANF rejection. DCF Commissioner Joette Katz addressed this on Thursday during a hearing before the Appropriations Committee.
We believe this budget enables us to meet our statutory mandates as well as to allow us to make significant progress in meeting the current WANF exit plan outcome measures.
Your request and the governor's recommendation is approximately $25 million more than your fiscal year 17 appropriation. You look at WANF compliance. How many of those, because in the governor's explanation, we have, or in your the background is, we've maintained compliance 16 of 22. And the governor is saying in his backup that the dollars are needed for all these services to fulfill 22 performance benchmarks. But if we've already met 16 of them, can you please tell us which of the services within this line item for WANF are actually wants, needs, or have-tos?
The reason I suspect that the governor put in 22 is because when the legislature rejected the plan, it still means technically and legally that 22 outcome measures are still operative. In truth, the services relate to the 6, the list and the appropriations that are being sought relate to the 6 that we have not met.
In the testimony that you gave before Appropriations Committee at the end of January concerning the proposed reduction of oversight that was negotiated. I believe your testimony was that you would be compliant with the remaining 6 by the end of the year, in that case the 10. Is that an accurate assessment of where you see yourself at the end of the year?
The question about the time frame, when this was negotiated last summer and presented to you all in September, it was my fervent expectation that we would be out within a year and have a second year of monitoring. Obviously, that's deeply conditioned on the amount of appropriation and the staffing levels and being able to maintain them. So I can put it back to you and say it's really up to you if I could do it within a year or not.
As I understand it, that would be based on the $801 million that was negotiated. That would be sufficient for the current year. And now with the proposal of $807 million being more than that, does that still support you being compliant as an agency and then going into the monitoring phase the following year?
So at the risk of being cute, I tried to tell everybody I thought 801 was a good deal. With regard to the future, what we're talking about is the years 18 and 19, and so I think what the governor's budget addresses is the anticipated rise in demand, both in terms of cases and needs of the children. And yes, it would be my expectation that if you decide to appropriate in accordance with his budget, that we will be able to meet those measures in a timely fashion.
Are we using 801 as the amount that you need to achieve your baseline, or is it 807 that is proposed in the budget?
Well, it's 6 months later, and based on the increase in cases over the last 2 months, and the expectation for purposes of the year 2018, I would advocate on behalf of the governor's budget. Because again, the number we were looking at was based on the summer of 2016 going into the fall. These numbers are now assuming we're still under 1F in 818 and 2018 and 2019, and I think the governor's budget accurately reflects what is anticipated the needs of the agency will be based on the current climate, both in terms of substance abuse and mental health needs of our children.
The funding for 1F compliance, I pulled up the fiscal note from less than a month ago for the same exact line items, and it's pretty drastic, the difference in the fiscal note for each one. Why these huge changes if in fact you had the latest data last month for these same exact line items that you may in fact already have contracts in place with some of these folks?
The governor's numbers are for 2018 and 2019, and I think reflect the reality that our numbers are going to grow, our demands are going to grow, our need for services are going to grow, and he's not frozen in time. I was essentially frozen in time. It was a result of a negotiation, and when I testified, I'm identifying a period of time that was in the moment and in the present for 2016 going into this year. What the governor is talking about is 18 and 19, and I think that's a realistic picture of where the state of Connecticut is going to be in that time period. And again, I was being cute before, and I don't really mean to be cute, but you understand that, and I know you do, that when you negotiate a settlement, everybody gives a little. And in this case, actually, frankly, I didn't think we were giving nearly as much as the plaintiffs were, and we were locking in, I was attempting to lock in a number that was as low as it was ever going to go. And I understand, I completely understand, and believe me, respect very much the separation of powers and the whole notion of having a federal court in our business. I really do understand and respect that, and I understand the whole concerns about lock boxes. There's no doubt about it. But again, not to be cute, but the number that you saw was really a number in time that I thought was the best that we were going to do, and I was going to do my darndest to make sure we lived within it and got out at the same time.
We need to know exactly what is needed, exactly what you project is needed in the 1F, where those services are going to be paid out, in what line items, and the contracts that you're talking about expanding. it's got to be very clear for them so that we can have a comfortable conversation going forward. Since we're working off of numbers that came in the beginning of February, now we have a different set of numbers.
As a result of the WANF settlement being rejected, the state has been notified it is in non-compliance with the current WANF settlement, and further court action is expected. Contrasting testimony before the Transportation Committee on Wednesday concerning a proposed bill to mandate motorcyclists to wear helmets in Connecticut. A previous law was repealed back in 1976. The issue has pitted riders against the medical community for years.
A motorcycle helmet law is not going to make motorcycling safer in the state of Connecticut. And we can get in and look at numbers and we can talk as to why I make that statement, but that's the first big statement I want to make. The second statement I want to make to you is that the state of motorcycling in Connecticut is at an all-time record high in terms of reduction in accidents, reductions in fatalities, and reduction in accidents that yield the most severe injuries. If motorcycle helmets are such an effective device, then why is it when you take the states that have had helmet laws for the past 40 years and you compare them to the states that have repealed the law anywhere from 20 to 30 years ago, statistically, our rate of fatalities and accidents and injuries is not significantly different. So the doctors are going to tell you that a motorcycle helmet will reduce injuries and fatalities. And I say to you, that is a correlation analysis. That is not scientific evidence. It's wrong to single us out and to simply say that we should regulate their personal behavior, remove their freedom of choice when we're not going to outlaw tobacco, when we're not going to regulate people's diets, when we're not going to put restrictions on the amount of alcohol one can consume. That is simply unfair. That's the reason we're here today.
I thought, though, in 2016, Rich, was that there was a higher rate of motorcycle accidents. Am I wrong?
The registered vehicles in 2016 were 89,642. The fatalities were 47, and the accidents resulting in serious injuries were 297. So yeah, there was a moderate jump on those accidents with serious injuries from 208 to 297. I'll grant you that. One of the things you got to remember is that this is the real world, right? So there are going to be years when there's more exposure because the weather's dry, people are riding more. We don't have a means of measuring that. But I guess my point would be to look at a single year jump from 2015 to 2016. It's a blip on the screen.
I'm thinking, okay, most of the public doesn't ride bikes. There might be 70 or 80,000 bikers in Connecticut, but 3 million people. So people just can only kind of relate in an abstract way. But it seems to me that you're making a decision every time you get on a bike that the risk of not wearing a helmet isn't that much greater than the risk of wearing a helmet, and that the freedom and the peripheral vision, other things that you might want to enjoy. So psychologically, it seems to me that all of you have come to the conclusion that, from your perspective, the benefit of riding without a helmet outweighs the risk of riding with a helmet. Can you kind of walk us through your mentality, or how you think that through, or how someone who is an avid biker?
Remember that what we're debating here is not helmet use, it's helmet laws.
Right.
And again, we have no objection to people wearing a helmet. Mm-hmm. And to try to answer your question, I can only speak for myself. I feel safer without a helmet, okay? Mm-hmm. I don't like saying that because I don't want to be convincing anybody of anything. I only have to speak for myself. Mm-hmm. But I will tell you this. The American Motorcyclists Association, of which I'm a life member, has polled its membership many times on this issue. And they support voluntary helmet use, okay? But their membership overwhelmingly, like 80%, rejects the notion of mandatory helmet laws.
I'm here to testify in strong support of the mandatory motorcycle helmet law that is before this committee. Motorcycle crashes in our state are frequent can be very severe and very costly. On average, in our state, we have about 1,600 motorcycle crashes reported by the police each year. Of those 1,600 crashes, 50 Connecticut residents die each year. The Centers for Disease Control has estimated that it costs our state each year $407 million. $407 million. Of that $407 million, $5 million is attributed to direct medical costs. $402 million is responsible for work loss. Currently, there are 19 states that have a full motorcycle helmet law, including 2 that border us, Massachusetts and New York State. Rhode Island has a partial law. There are 28 states, including Connecticut, that has a partial, ineffective law, like Connecticut. In our state, you have to be 17 years of age and younger to wear a helmet. There are 3 states that have no motorcycle helmet law: Illinois, Iowa, and New Hampshire. So this is what happens. When you pass a mandatory helmet law, you get high compliance with wearing a helmet. Over 90% of riders will wear a helmet. They comply with the law. It's easily enforced by the police. In those 28 states that have a partial ineffective law like ours, you have a voluntary motorcycle helmet use rate of about 50%.
But some of the data that the opponents of the bill were suggesting is that statistically, the data that they were quoting didn't show a substantive variance between those who wear helmets and those who don't, in terms of some of these other states that have laws versus the ones that don't, in terms of the type of deaths and those with and without. If I'm hearing correctly, you're saying from your data that is not correct. Could you clarify that?
There's really no scientific argument around this. So, for example, in the most recent data that we have, I think it's 2014, in those 19 states that had a helmet law, there were 180 deaths, unhelmeted deaths. In the 28 states that had the partial law or no law, there were 10 times as many, 1,800. The populations of these states are roughly the same. So you're seeing a tenfold difference.
I would just question, on its surface, that would lead you to one conclusion, but it's really not a fair comparison, is it? Because the states where, let's say, there were 10 times as many more deaths, there could have been 100 times many more riders. So it's really not the absolute comparisons. It's got to be, you got to compare the rates of incidents where it occurs. So if you had 1 million bike riders in one group and you had 1,000 in the other, well, the statistical comparisons would be extremely misleading one way or the other. It could be very favorable and negative. So do you happen to know what the other details are?
The comparisons between states that have mandatory laws versus those that don't, the populations in those 2 groups are roughly the same. The number of deaths are dramatically different.
Now,
so it's not based on the number of registered riders, it's based on the number of population in that state.
Okay, well, again, and I just think it's important that we have information that's complete and accurate, and we understand what the assumptions are behind it. And to me, it's not, again, it shouldn't even be the population of the state in its totality. It's the population of motorcycle riders that you got to be talking about.
Any possible votes on this proposed legislation will be determined by the Transportation Committee leadership in the coming weeks. On Tuesday, Governor Malloy was in Hartford as part of his latest effort to prevent opioid abuse and deaths in the state. The purpose of the briefing, to announce Hartford as one of 3 cities in the nation to receive grants from the United Health Foundation to target teen substance abuse and addiction.
We're very excited today to announce the grant of $2.4 million to 2 organizations that we found very worthwhile here in the city of Hartford that can help us. The Governor's Prevention Partnership We'll create an awareness and outreach program for children, parents, and the community. With the help of United Healthcare employees throughout the city, we'll work to develop programs to identify and refer high-risk youth to after-school programs. For their part, the Village of Families and Children will bring mental and behavioral health services into the primary care setting. We know that if we get people recognized for having behavioral health conditions in the primary care setting and we can quickly get them to help, they'll get the help that much more quickly and it'll be that much more successful.
Certainly much of the early story was about the easy way to acquire pharmaceuticals. Heroin that was formulated for the treatment of pain. In this particular case, we should note that on a self-described basis, 60% of the people who get a prescription for an opioid for pain do not use all of the drug. And what happens is it lies around in a cabinet, in a house somewhere. A child or a friend of a child or someone comes into the house, takes it, gets addicted, and before you know it, we're confronting the potential of another death, and certainly the actual diminishment of a life story that otherwise wouldn't take place. I think ultimately what we want to do is spend these dollars making sure that people are as knowledgeable as possible to avoid being introduced to opioids, and are as knowledgeable as parents and uncles and grandparents and brothers and sisters to what the threats of opioid addiction are.
I've been with the Governor's Prevention Partnership for about 20 years now, and I was just thinking as I heard Governor Malloy speaking, when I first started, we were really worried about young people smoking cigarettes, believe it or not. That was just 20 short years ago. Since the time the ante kept getting more serious, we were working on underage drinking, marijuana use, and now the heroin epidemic. So the crisis is there.
When we had the opportunity to apply for this grant, we knew that we're going to do something with great level of innovation and also looking to bring better outcomes for health, for families, and for children.
The program supported with the grant dollars will be monitored for results over the next 3 years. In the meantime, the governor has submitted legislative proposals to be considered this session regarding opioid abuse. They include electronic-only prescriptions for opioids, expanding efforts to dispose of unused medications in homes, and allowing individuals to sign anti-opioid directives related to their health care in the future.